Hello everyone. The Department of Paediatrics, Sri Ramachandra Institute of Higher Education and Research brings you a panel discussion by experts on the COVID-19 pandemic in children and preparedness for the third wave. The ongoing global pandemic has affected several millions around the world and caused over 4 million deaths. India has already faced two waves, and the ICMR has predicted a third wave, which is likely to peak in September. There is an apprehension that this third wave will particularly affect the vulnerable sections of the population, those who have not yet been vaccinated, the children below 18 years, and the pregnant women. So naturally, the biggest concerns that parents have now is what is going to be the impact of this third wave on their children, and what are the precautions that they should be taking at this point of time. It would also be reassuring to know how the healthcare providers have prepared themselves to face this challenge of a surge in the numbers when the third wave occurs. I am Dr. Padmasini, Professor of Pediatrics at Sri Ramachandra Medical College, and we are fortunate to have with us three distinguished professors from our institution to answer these questions. We have Dr. Ramachandran, one of the senior most professors in the Department of Pediatrics. He is also the Associate Dean of our medical college. And we have Dr. Rajkumar, Professor, Pediatric Intensive Care Unit, who has vast experience in managing critically ill children. And we have Dr. Uma Maheshwari, Professor, Department of Neonatology, with a special interest in perinatology. She provides care to babies from the time of conception, when the baby is still in the mother's womb, till 28 days after birth. On behalf of the viewers, I thank each one of you for sparing your valuable time to be with us this afternoon. The first question is to Dr. Ramachandran. Sir, what is this third wave and how is it going to affect children below 18 years?
From March onwards, we started getting again increasing number of people getting affected with COVID infection. So that was described as a second wave. Again, this differed in different states at different times. For example, the state of Maharashtra, it occurred much earlier than state of Tamil Nadu. So every state had its time of onset, time of peak, and time of coming down. In Tamil Nadu, we had the maximum occurrence sometime in May, and from first week of June, it has started coming down. So we expect that the second wave, for all practical purpose, would have been over by middle of July. Now, what will be the time between one wave and another? Nobody can exactly say, but looking at the previous occurrences, it is anticipated that a third wave may start between 3 to 6 months after the second wave subsides. So, the ICMR and other government national bodies are predicting that the third wave may start anything from September or so, but it may not be uniform in all the states at the same time. The reason for one after another these waves occurring is the virus keeps changing its nature. It is not what it started as original in March 2020. The second wave, as most of you would have seen in the newspaper, there was a change in the virus structure. So that is called a mutant virus. So popularly the official term for this is a Delta strain. So because of this, many people, and each time when the virus changes its nature, its type of infectivity, how many people it will affect, that also changes. So, a second wave, we had quite a substantial number of people getting affected, and also those who have not got the first time infection, they get they are likely to get affected mostly whenever another wave occurs. So the second wave, we did see somewhat slightly younger age group people also getting affected more. So the third wave, if at all it occurs, may be occurring in different states at different time, probably after the second wave subsides, about 3 months or so.
Sir, as a parent, my main concern is this third wave going to affect children below 18 particularly severely? When should I suspect that my child has the COVID-19 infection, and what should I do in that situation?
If you look at the numbers as such, between the first wave and second wave, there was definitely more number of people getting affected. But if you are looking at the percentages of children who got affected, it remained almost same as per the Government of India statistics. If you take children up to 18 years, the Government of India calculators has calculated up to 20 years. It was roughly the same, around 10 to 12%, the first time also, the second time also. The only thing is, the total number is more. This 12% may become more in every segment of the population. So same way, if you are going to have more number of people getting affected, probably more children also may get affected. The second possibility is, as children have not got vaccinated, there is a possibility that a few more percentage of children may get affected. But it is all in the realm of speculation only now. We do not know. The other question which was asked was regarding the...
What should a parent do when he or she suspects that the child has COVID-19 infection?
Yeah. Generally, this infection occurs in the families because the children do not go out much, and mostly the adults who go out, and they are the ones who are likely to have the infection first. So when a father or mother in a family has fever and COVID-like symptoms, which most of the people now are very well aware of, some sore throat, cough or cold, they may have to look out for the child, whether the child is developing any of the suspected symptoms. What are they in the children? Same as adults. It may be fever. Some children may have cough or cold or running nose or sore throat. Depending on the age of the child, how much they are able to tell the symptoms, it may vary. Some children may have some stomach upsets also. They may have diarrhea or vomiting. So, if in this pandemic situation, any child having fever, developing any of the respiratory, that means cough or cold, or any stomach related symptoms, one has to suspect COVID infection, especially if also an adult or another child in the same family is already having a COVID infection. On suspicion, they will have to get the test done. The only way the confirmation can be done is by doing the test for COVID infection.
Do all these children require to visit a hospital?
The confirmation of the diagnosis, for this purpose, they will have to have some kind of a healthcare access. It can be done at home. If they can have a collection of the specimen at home, it can be done at home. But they have to be in touch with the healthcare provider. What I mean healthcare provider is a doctor or a pediatrician or their family doctor with whom they are very comfortable. They have to keep in touch with them and keep updating them regarding the child's clinical status. That means how the child is active, feeding well, taking liquids well, sleeping well, not very tired. This type of information should be shared with their doctor on a daily basis till the child becomes totally alright. More than the test and other things, this type of constant contact with their healthcare provider, that is a doctor, is very important till the child is quite stable.
Thank you, sir. Dr. Rajkumar, Professor has already mentioned that most of these children will have a mild infection and can be managed at home. But what are those symptoms which should alert a parent, for which the parent should immediately seek help in a hospital? How useful is a pulse oximeter for monitoring these children?
Fortunately, most of the children can be managed at home, but some children become sick, and one of the most important symptom which would alert the parents to bring the child to the hospital immediately is a difficulty in breathing. So older children may even be able to tell that they have difficulty in breathing. Small children, the mother can note that there is a change in their pattern of breathing, So you can see that the children start breathing fast. Sometimes the chest will be going inside when they breathe, and their activity level will come down instead of their usual activity. Usually when the fever settles down, even with infection, most children are active, so they become less active. Some small babies may not be even be able to feed. So these symptoms tells them that the child is having increase in the lung involvement, and they should immediately contact the doctor and then come to the hospital. In adults, many times we advise pulse oximeter to measure the oxygen level. I think that has become a very common practice in the previous two waves in the adults. But in children, sometimes it is many times it is very difficult to have a correctly fitting pulse oximeter. When children move, and especially if the fit is not appropriate, the values may be erratic, and sometimes it can give either false reassurance or sometimes it can unnecessarily cause panic. So older children, like adults, pulse oximeter can be used. Very small children, we have to go by other indicators like their activity level, how fast they are breathing, and those things will be important clues. In addition to breathing problem, in children with COVID, gastrointestinal symptoms like diarrhea, vomiting, that is also very important. And what happens is sometimes they don't have the appetite to eat and drink, and they are losing fluids in vomiting and diarrhea. If it is not appropriately replaced, children tend to get dehydrated, and that can also land up in problems. So the parents will have to ensure that they take at least liquid diet, even if they are not taking enough amount more frequently. Even the ORS which is given for the normal diarrhea can be given. And in case if their urine output is coming down, if their children are not passing the usual frequency of urine, if they are not taking it orally well, when that is an indication for coming to the hospital. There is another group of children who are very vulnerable to develop severe forms of COVID, like children who already have pre-existing illness, like children with asthma or other lung problems, children who have underlying heart conditions, children who have deficiency in their immunity, or some children with chronic illness, they are on regular medications to decrease their immunity. So these and also children who are obese. So these children are at risk of developing severe infection, and these children also may have to be sometimes even before the symptoms become severe, they may have to come to the hospital. So being in touch with the doctor, as was discussed before, is very important in these situations.
Yeah, thank you so much. And how is severe COVID infection managed in children? Do you have the same protocol as you have for adults, or is it different?
So the basic management of severe COVID is going to be the oxygen therapy to maintain the oxygen level, to give steroids either orally or by injection for the lungs to improve, and ventilatory support like breathing machine support if the lung problem increases. So these basic management is pretty much the same for children compared to adults. But there are some differences, like we tend to do the management in a more child friendly environment. The oxygen delivery devices will be titrated because some children will not tolerate certain type of oxygen delivery devices, and if possible in the early stages we even allow COVID positive attender to be with the child to reduce their anxiety, and the doses are different depending on the child. Coming to the other forms of therapy, like blood thinners are used very much upfront in adults. In children, we use them less often, only if there are specific indications. Similarly, there are other medications, biological medications, some of which are used to tone down their immune system, the chemical reactions that happens in the body. Even those things, there is not much of recommendation for use in children. So those things are used very sparingly in children. But fortunately, the number of children who become that ill needing this type of treatment is very less. The other main difference in children is that we do not routinely do CT scan of the chest for diagnosis of COVID infection. Unfortunately, I have seen few parents getting the CT scan done outside even before seeing the pediatrician. That should not be done. It is not useful, and it will only unnecessarily expose children to radiation. That is another difference in children.
Sure. Dr. Uma, another vulnerable section of the population is the pregnant women. What is the impact of COVID-19 infection in a pregnant woman on the baby in her womb?
Thank you, ma'am, for the question. I think pregnancy is a unique situation where both pregnant women and the fetus can be affected. So generally, if you take a comparative basis, compared to a non-pregnant women, pregnant women can get severe infection. So, especially the women who are more than 35 years or who are having pre-existing conditions like diabetes or hypertension, they are at increased risk of developing severe COVID infection per se. And also there are certain conditions which can happen in an increased frequency in any pregnant woman, which happens higher in a COVID patient. So, say for example, we call a specific condition called preeclampsia, and also mother gestational diabetes. That means diabetes happening during pregnancy. And also blood clot problems, thrombosis. These can happen in a higher extent in a COVID affected pregnant women. And also, if you ask what are the effects in the fetus, they are at increased risk of having a growth retardation or even stillbirth, and also being born prematurely. So, premature infant per se has many complications and they have to stay for a longer period in the neonatal ward or unit. So, in that way, definitely COVID infection in a pregnant woman has its own consequences, not only for the mother, also for the fetus, and little rarely for the newborn.
Is it known to cause birth deformities like the other viral illnesses that occur during pregnancy?
So generally no, there are no known congenital malformations which has been reported so far following COVID in pregnancy. But one has to be aware of using teratogenic drugs, like say for example ivermectin is one such medicine which is used generally in COVID. In some indications they use in adult patients, but that should not be used in pregnant women. So whatever medications they are using, they should be aware of the fetal consequences and use judiciously in a pregnant woman. But generally there are no known congenital malformations which occur in a COVID positive pregnant woman, even if she is occurring in first trimester.
That is very reassuring. Currently, all pregnant women are being screened for COVID infection by the RT-PCR test when they come in labor. How is the management going to differ if the test is positive?
Okay. Is generally like when the pregnant woman is getting admitted for safe confinement, they are being screened. Compared to the first wave, the percentage of women who get positive in the second wave were higher. In the first wave, there were almost 5% of the pregnant women who were screened turned out to be positive, whereas in the second wave, almost 20% turned out to be positive. So, irrespective of whether they are asymptomatic or symptomatic, the babies, if they are well, if it's a term baby, no complications, they do not warrant to come into NICU. Otherwise, they are roomed in and nursed in along with the mother. So, the mother is encouraged to give breastfeeding because breastfeeding has certain antibodies. That means some cells which are some immune power which are very good for the baby if it is getting transmitted through the breast milk. So, in certain studies, they have proved that in fact the nursing mother, the breastfed infants are at lower risk of developing COVID infection. So, we always room in the baby along with the mother and encourage breastfeeding. Of course, she has to follow all the respiratory etiquette and she has to wear a 3-layered mask and she has to wash hands frequently when handling the baby. Except for that, like she can breastfeed. Even for preterm babies who are admitted in the NICU, we encourage them to give expressed breast milk, and that expressed breast milk we give to the baby because they have immunoglobulins or antibodies against COVID-19.
So, as long as the mother's clinical condition permits, she continues to nurse for the baby as before.
Yes.
Sir, you mentioned that most children with COVID-19 can be managed at home. How should they be managed at home? Is there a protocol?
As we were mentioning, nearly 90% of the children with COVID infection or either do not have any symptoms or any problem. They were identified just because the adults were having COVID and the testing was done, they were found to be positive. Or They have very mild symptoms as already described, a mild cold, cough, and 1 or 2 times diarrhea. That is the type of problem. So these children can very well be managed at home with the general precautions for like any other fever. They may require fever medicines. The commonly used fever medicine is paracetamol. This medicine is given as per the doctor's recommendation based on the weight of the child. Usually we give once in 6 hours, and that is a recommendation the parents can very easily follow. They need not go for any very stronger medications or more frequent administration. I think they should follow the doctor's advice, and generally the fever in such children doesn't last for more than 2 or 3 days. The second thing is the feeding. They should be given the feeds whatever they have been taking before the same way. There is no need to change the diet. Third is they have to be given adequate fluids. They have to pass a good amount of urine, and fluids in all normal fluids, whatever they are used to, they should be getting it. The fourth one is they have to be kept in a separate room with an attached bathroom, because if all the people in the house are already affected with COVID, that may not be, such an isolation may not be required. On the other hand, if this is the only child who is found to be positive, there is another child at home who is not affected, then the affected child, this child, has to be kept separately in a room with an attached bathroom. And if the child is more than 5 years, they can be encouraged to wear a mask. Children less than 5 years usually find it very difficult. More than 5 years generally, they can be encouraged to wear a mask. And the mother is the one who is going to look after this child. And when she goes inside the room to feed the child or take care of the child, she has to wear the mask, and she has to use the hand hygiene before and after the handling the child. So these are the precautions. The most important thing one has to remember is the elderly people, if they are in the house, they are the ones who require a lot of protection, because children may not have much symptoms or problems, but if there is a grandfather or grandmother who is very vulnerable for the COVID infection, they should not come in contact with this child. That is the one thing we should remember. Unlike in other situations, they should not be allowed for the grandparents to handle these children. It's better the father or mother take care of these children. What they should remember is the monitoring part of it. At home, what are they going to do? They have to just check the temperature and also see whether the child is taking food or fluids adequately. As mentioned, if a child is breastfeeding, whether the child is taking well, whether the child is unusually tired or irritable or not active, that they have to keep monitoring. They also have to see whether the child is having any fast breathing or anything, the chest is going inside when they breathe. So that is an indication that the child is having some complication. Lastly, if the child shows some color changes in the body, like some bluish color or something like that, even if it is for a short duration, that they have to consider as a warning sign. So these are the things. Or if the fever continues, as already mentioned, usually the fever lasts for about 2 or 3 days. The fever is there for more than 5 days. It may be a problem due to COVID infection, or it may be sometimes some other common infections we have in our country, like typhoid and other problems. So these are the things the parents should look out for. Fortunately, none of this is very common, but in a given child, by chance any of these problems are occurring, they should bring the child to the hospital. Of course, they can immediately get in touch with their doctor also.
Thank you, sir. So it is reassuring to know that most children with COVID-19 infection have a mild or asymptomatic illness and they recover completely without complications. But Dr. Rajkumar, There is a lot of news in the media after recovery from COVID, children developing complications. What are the complications that can develop after complete recovery?
So it is important to know that children can develop a complication few weeks after they develop a COVID infection called as MISC. I think this name is nowadays known to many people because it is circulating in various social media. So this is a condition which happens maybe about 2 to 6 weeks after the actual COVID infection. At that time, they may not have the active virus in them, even the PCR test may be negative, but they may have fever and other symptoms which can affect the organ function. So the MISC stands for multi-system inflammatory syndrome secondary to COVID. This was initially came to attention in April 2020 when a lot of children had similar presentations like a previously known disease called Kawasaki, and there was an association with COVID infection in the past. And now it is well known, and in fact most of the admissions in the hospital, in children's hospital in Chennai in the last few weeks had been for MISC rather than the actual severe COVID infection. And so usually they will have fever for few days going on, and along with that, if they have any organ symptom functions dysfunction, like they have vomiting, diarrhea, they may have rash, and they may have decreased blood going to the body, we call it a shock. When these features are there, we suspect MISC, so parents should be aware of this complication, and mostly they need to be evaluated in the hospital. They will need some investigation, blood test and some scan, so they have to bring the child to the hospital, so that is very important. Some children with MISC have problems with their heart function or blood vessels supplying the heart. Usually it is temporary, sometimes it could be long term. However, with the early diagnosis and appropriate treatment, most of these changes become normal, and hence it is important for children even after discharge from MISC to be on regular follow up with their child specialist as well as heart specialist.
Okay. So they have to bring the child to the hospital if there is recurrence of fever after recovery from COVID.
So they have fever for more than 48 hours. Along with that, if they have other symptoms like red eyes, body rash, they may have redness or swelling of the lips, tongue and the palms and soles. These children also may have diarrhea, vomiting, breathing difficulty, increased sleepiness and drowsiness, and sometimes their hands may be very cold to touch. They may be passing less amount of urine. They need not have all these features, but if any of these features are present, or even otherwise if the fever is there, high fever is there for 3 days or more, even without other features, it is better to come and then get evaluated by a pediatrician or a doctor, because in addition to these clinical features, some other tests also will be required to come to the diagnosis, and some of these children can become very sick, but fortunately there is a very effective medications, and if it is given, diagnosed early and treated, they recover well. So it is important for parents to remember this.
Okay. And how common is this? Because like Madam said, almost 5% of the tested population is testing positive for COVID. How common is this complication in children after COVID infection?
Now, fortunately, this complication is very rare. Overall, they say about out of 100 children, maybe around 1% of children may develop this complication. But as I told before, even the difference between the other normal COVID infection and this MISC is that many of these children will need evaluation and specific treatment. So that is the reason why we are stressing that. But there is nothing to panic as such. The number of children who develop this is very small.
Sir, we know that in the third wave, it is likely that children may get affected in larger numbers. What advice do you have for the parents? What precautions can they take to prevent their child from getting the infection?
As of now, there are no vaccines approved for children. In other countries, they have started using the vaccines from 16 years onwards. Now, probably some countries they have approval from 12 years also. But still, trials only are going for children less than 12 years of age. There is no vaccine available anywhere for a child less than 12 years of age as of now. So, we cannot depend on vaccines till it gets approved, until it's available. So, what else the parents can do? They can avoid whatever the situation which will bring COVID to the child. That means better to avoid in crowded places, taking a child to a crowded places, and many other functions where there is likely to be a lot of crowding. They can avoid that. One. The second thing is they can protect themselves. If they have not had the vaccines, it's high time that they complete the vaccines. Whatever the recommended vaccine, whatever the available vaccines which are available to them in their place, they should complete both the doses of the vaccine at the earliest. That will protect the child, as well as if they have some elders in the family also, they will also get protected. So whoever is eligible for the vaccines, now anybody more than 18 years can take the vaccine. So better to complete the vaccination as early as possible. That is the most important thing. Third is keep the child as normal, as healthy as possible. Let them have the normal, usual type of activity within the house, and not eat too much, and not to put on too much of weight, because sometimes overweight also is a problem for some of these children. And have adequate amount of sleep, good amount of sleep. Okay, I mean, have a good some type of a control over the screen time, which is not academic. So all this general precautions or the general advice will be also be applicable to COVID situation, because these are some of the small things which can interfere for a problem for a child. Lastly, children who have some other problems like comorbidity, other things, please get in touch with your doctor, and whatever the recommended drugs which can be continued, they have to be taken in a regular form. None of these regular medications which the child has been taking, with the advice of the doctor, they should continue those medicines. So some of the things which they can do to minimize the risk of a child to get COVID infection.
Thank you, sir. Do you recommend steam inhalation as a preventive method in children?
Though it is a very popular, as per the WhatsApp and other social media groups, there are no studies or there is no available literature or anything to say that this actually helps in reducing the severity or preventing COVID infection. Plus, please remember that in children, there may be a risk of getting some serious burns or some injuries. Unlike adults, they are quite delicate. Even their nose, mucosa, everything is quite delicate. So, it may not really help much serve the purpose for the children to try this. Okay. So, till we have some definite scientific evidence that it helps, it is better, may not be required for children.
Dr. Uma, sir just mentioned that it is a good idea for the family members to get vaccinated. Is it safe for pregnant and lactating women to take this vaccine? What advice do you have for young couples who are planning to start a family in this year 2021?
Thank you, ma'am, for the interesting question. So, till recent past, the Indian government did not recommend vaccination for pregnant women. Only on 26th of June, it had been approved to give vaccination in pregnant women. The benefit versus risk has to be explained to the women, and vaccination is recommended both by ICMR as well as WHO and other national bodies. So, regarding lactating women, yes, it is very safe to give for lactating women. So, as mentioned previously, lactating women also secrete these antibodies to their babies, so their babies will get extra protection by vaccinating during lactation. And regarding a couple who is planning to have their family, again vaccination is indicated in them, and it is safe for them to get vaccinated before they even become pregnant. Because just a few minutes ago we kind of talked about what are the effects of pregnant women getting a COVID infection. Definitely thinking about all those things, a couple who is planning to enter into a family, so they should get vaccinated. Of course, we should not forget all the COVID appropriate behavior they have to follow.
Very true. Do you recommend any specific time cap after taking the second dose of vaccine before getting pregnant?
Because now it has been approved even during the pregnancy, so it is nothing like that. But generally they say we have to kind of, even in the pregnant women, it is better to get vaccinated as early as possible before second trimester is over. That means before she enters into 28 weeks into her pregnancy, it is better that she receives both the vaccination so that it is protective for her and also the fetus.
Sure. So, because of this pandemic and the lockdown restrictions, many children have not been able to take their routine childhood vaccines. Should they be brought out in this situation for their immunization?
Okay, as the situation has started improving and children now do require protection for against other diseases also, because they should not suffer because of lack of vaccines. So, whatever the vaccines which have been missed out, the children can be brought to the hospital. We take all the precautions in the hospital to keep proper distancing and avoid any crowding, and immediate care for these children who are brought for the vaccines. Sometimes we may combine, previously we may give just 1 or 2 vaccines, but if the parents, it's agreeable to them, we can give up to even sometimes 4 vaccines at a time, provided the child is comfortable and will not produce any more reaction. So, we do see to that and give these vaccines. By some chance, if a child had COVID, many parents ask this, when should he take the vaccines? It's a very rare situation, but if the child has had COVID disease, government recommends after 2 weeks the child can be taken to the hospital for vaccine. Generally, most of the pediatricians, as an extra precaution, we advise them to be brought to the hospital for vaccine after 1 month of child becoming all right.
Thank you, sir. Dr. Uma, I have one more question for you. If the mother has tested positive for COVID and she now delivers a baby, is there any indication for testing the newborn? How should this newborn be followed up?
Generally, we room in, as I told already, and do exclusive breastfeeding, and we test the newborn around 24 to 48 hours. In case if the baby has to get discharged prior to that, we test for the newborn and then send them home. And after that, we have a telephonic conversation with the parents, and also we ask them to come to the fever clinic once to check the weight and also to check the jaundice status. So, these 2 things we do regularly for any newborn who is born to COVID positive mothers. Generally, from our experience, we have had very few babies turned out to be positive after the mother had COVID positive illness, and they remained well.
Sir, can you please tell us what facilities are available in Sri Ramachandra Hospital for managing children with COVID?
When children who are suspected, they are brought to the hospital with COVID, first they are checked by the doctors, the child doctors, and if they suspect, they tell them to get the test done, and it has been made very friendly, child friendly. They need not go to many places, it's quite nearby, they can, with just next to the outpatient department, it can be done, and the experienced lab people are available. They will do the test without much discomfort to the child, and after that, whatever the required advice for home care is explained to them, and also printed material is given to them, both English and Tamil. There are what they should do at home, at what point of time they have to get back to the doctor or bring to the hospital, that explanation also is given. Plus, there is a home care package where certain things which are required for the child, like paracetamol and other items, and for older child a pulse oximeter, all these things, thermometer, all these are there in that pack. So, it is handed over to them. Plus, they are also given that facility of a doctor talking to them or a nurse talking to them once or twice a day to find out how the child is doing. So, this facility is also a part of that package. So, because we said majority of the children are going to be managed at home, the continuity of care at home, some doctor being in touch with the parents is very important. I think that is one thing which will reassure the parents a lot. If necessary, they have to get admitted in the hospital due to many reasons which we already described. There are enough beds available to manage a child with just to give some intravenous fluids or some little bit of oxygen. So there is a COVID specialized the separate areas are available. Plus some children may require slightly more facilities like more oxygen, or they may have to be monitored by the doctors more frequently. So that is a place called high dependence unit, that is also available. Very rarely some children who require oxygen, some ventilatory support like giving oxygen at high pressure like this. So they may have to be admitted in a pediatric intensive care unit. Those facilities are also available. So for depending on the child's status, home care, a hospital in a general ordinary COVID ward, or a high dependence unit, or an advanced pediatric intensive care unit, all these facilities are available and expert care is also available. Another special feature of our Ramachandra hospital is, this is one of the very few hospitals where we care for children up to 18 years of age. We do not stop with 12 years, up to 18 years, because we also said this adolescent age group may be a little bit more risk for COVID infection. So we also offer the care for this adolescent children up to 18 years of age. So these are some of the facilities which we have in Ramachandra. So we just wanted to highlight on this.
Thank you, sir. With this, we come to the end of this program. If there are any further questions, please feel free to put them in the comment box. Our experts will get back to you with the answers as early as possible. Thank you for watching.